In this video, we're going to talk about the diffusion of gases in the alveoli. Hey guys, what's up and welcome back to my channel. Today, we're continuing our respiratory series, and today it's all about the diffusion of gases. Ew, gross, not those gases. I'm talking about oxygen and carbon dioxide. We'll talk about how the diffusion of gases takes place and certain scenarios that can affect this diffusion. I know every minute of your time is valuable, so I appreciate you watching. Without further ado, grab that pumpkin spice cold brew and let's get started. So the diffusion of gases between the capillaries and the alveoli follows the rule of Fick's law of diffusion. And Fick's law of diffusion states that diffusion rate equals surface area times membrane permeability times concentration gradient divided by membrane thickness. So some factors are directly related and others are indirectly related. Surface area, membrane permeability, and concentration gradient are all directly related to diffusion rate. This means that as one of these variables increases, diffusion rate also increases. So let's take the example for concentration gradient. In the lungs, if I have no oxygen on one side in my capillaries, but I have all the oxygen in the alveoli, then the concentration gradient is steep, and oxygen will flow quickly from the alveoli to the capillaries. Now, while that's the formula, there are other things that can influence the diffusion rate, and these are distance of diffusion and temperature. In the lungs, membrane permeability and temperature are constant. So let's talk about surface area. So the more surface area we have in the lungs, the faster the diffusion rate. Now, what actually makes up the surface area? Well, it's actually the structure of each alveoli and the number of alveoli that we have available to use. So if you have a normal alveolus, you can see that it has curves and folds in it. And the folds are the things that look like little grapes. And these folds increase the surface area. But with something like emphysema, alveolar walls are destroyed, and this reduces surface area. In emphysema, chronic cigarette smoke activates macrophages in the alveoli. These macrophages release enzymes that break down alveolar walls. So as you can see in this alveolus, you might have a normal oxygen level, but the reduced surface area due to the reduced folds actually decreases the diffusion rate. So now let's talk about diffusion gradient and concentration gradient. So in the lungs, the diffusion gradient depends upon how much air we can get into the alveoli and not on the capillaries. And this is because blood is constantly moving away from the alveoli. The capillaries are constantly bringing more deoxygenated blood to the alveoli. So this helps keep the concentration gradient in effect. But if we are not ventilating well, then we're not getting enough oxygen in our alveoli. And if we only have a small amount of oxygen in our alveoli, then this actually ruins the concentration gradient. So here in this picture, we have an alveolus that we are not ventilating well. Asthma is a condition that causes bronchoconstriction and therefore decreases the amount of oxygen that we can get into our lungs. And a low amount of oxygen in the alveoli ruins the concentration gradient. So if the oxygen level in the alveolus is about the same as the oxygen level in the blood, then the rate of diffusion slows, which means the capillaries will not get as much oxygen in them, which means that blood will leave the lungs still deoxygenated. So now let's talk about the distance of diffusion. So remember we talked in our last video about how the distance of diffusion is very short. The capillaries and the alveoli are effectively connected by a basement membrane. And this is necessary for the exchange of gases. And I think I told you last time to star this principle and shout it from the rooftops. So hopefully you did that. And now let's wait and see if that echo comes back to you. All right, so now that you have that principle down, let's continue. So any condition that increases the distance of diffusion will make it more difficult for gas exchange to occur. So with pulmonary edema, a condition that is sometimes found in heart failure, there is fluid in the interstitial space, and this fluid increases the distance of diffusion. For lack of a better explanation, it effectively moves the capillary further away from the alveolus. and this makes it harder for oxygen to go from the lung to the bloodstream. So even though the oxygen level in the alveolus may be normal, it's just harder for oxygen to get into the capillary. And if not enough oxygen can get into the capillary, or it takes too long of a time, then the capillaries will still leave the lung mostly deoxygenated. Now, there are some conditions that have multiple ways of impacting diffusion rate. So in fibrotic lung disease, remember that the lungs are restricted and they're less compliant, which means they can't expand. And there's actually scar tissue that forms on the alveolar walls. And remember that if the lungs are less compliant, then they can't expand to ventilate. And if they can't expand to ventilate, then we will have a lower oxygen level in our alveolus. And this can decrease the diffusion gradient. And the distance of diffusion will also increase because now there's a barrier, the thick alveolar wall, in the way. So for a quick recap, pathologic changes can decrease alveolar surface area, increase alveolar wall thickness, and increase the distance of diffusion between the alveoli and the capillaries, or a combination of any of these. So now I hope you understand a little better the conditions that can affect the diffusion of oxygen and carbon dioxide. If you don't, I guess I failed you and used up about 7 more minutes of your time that could have been spent on social media or staring at your phys book. If you did get value out of this video, then tap the like button. And if you want to connect or have questions, then comment down below. Next week, we're going to continue this series, but I'm always open for suggestions. After all, this is your journey and I'm only a part of it. Thanks for watching, and I'll see you guys next week.